We're learning more tonight about internal strife between Klamath Health Partnership executives and its board of directors. Thank you for choosing NBC5 News at 10 on Cozy. I'm Andrea Boyd. NBC5's Kate Sterling has an update to the story we first told you about last week.
The loss of KHP would be devastating to this community. That's 11,000 patients without access to care.
Klamath Health Partnership executives say that's just one potential impact if KHP were to close its doors. It operates clinics in Klamath Falls and Chiloquin, providing the community with affordable primary and preventative health care.
We provide services to the most vulnerable. It's patients who are best served in other languages than English. It's patients who are 100% of the poverty level or lower. That's 50 or more % of our patients are at that level, and we provide that on a sliding fee, and we're one of the only clinics in town that can do that.
But its mission of serving the underserved is in danger of failing, according to executives. They say the company's board of directors has been out of compliance with regards to composition since February.
That, because of their non-compliance in their composition, we've been contacted by HRSA stating that conditions have been placed on our federal funding, which is about $2.8 million. That's a huge part of our organization.
But executive staff say it's about so much more than the funding.
You know, for me to look at a budget sheet, that's not looking at numbers and dollar signs. That's looking at 11,000 patients and 160 employees who count on us day in and day out for healthcare and for a living wage. As a CFO here in Klamath, and it's a small community, those 11,000 people, those are my friends, my family, and my neighbors. And so I have a responsibility to them to ensure that their investment of trust into us returns a dividend of viable medical care and access to medical care in return.
Executives say the board's inaction and financial irresponsibility, including being more than 9 times over their budget for legal counsel, have already begun affecting their day-to-day operations.
When I begin seeing lines like that and I have to take funding from the budget and put it in a line that it wasn't budgeted for, it means that we do have to make cuts. We have to make hard decisions.
We've had to delay getting new dental x-rays, for example. We were able to provide them, and we still have those services, but we are having to delay getting equipment that can help us be more efficient in providing patient care.
Executive staff have called on the board of directors to resign, saying they have no confidence in the board's willingness to work together.
We've been here 27 years. We want to be here another 27 years. And we have to take these steps to ensure that we're a sustainable organization and that we can do this going forward. And we can't do that without a board that's going to collaborate with us as a team.
In Klamath Falls, Kate Sterling, NBC5 News.
We reached out to the board of directors for comment. We have not heard back. Stay with NBC5 News for updates on this developing story.